let's move on, because the other question, why don't you do both? Why don't you do bevacizumab and PARP together? And again, we have that published in the New England Journal. The approval is in process. And so Sharon, tell us about the study that we call PAOLA-1. There's a 1 after it, just like SOLO-1, because it's a first-line study. Go ahead.
So PAOLA was one of the really groundbreaking discussions that started from ESMO. This was a trial that enrolled women with stage 3 and stage 4 epithelial ovarian cancer. So really patients, regardless of surgical outcome, were enrolled, which was a little bit different than PRIMA. These women who were eligible for the study all had to have either a CR or a PR following carboplatin, paclitaxel, and bevacizumab. So this was a European trial. It was enrolled throughout 8 different countries. So bevacizumab was utilized in the frontline setting with chemo and then as maintenance. So these women were then randomized, if they had a CR or PR, to either bevacizumab alone, or they could have olaparib and bevacizumab. So the bevacizumab arm was continued for 15 months, and the olaparib was continued for up to 24 months, or until there was some type of unacceptable toxicity or progression. So the primary endpoint on this study was time from randomization until investigator assessed disease progression or death. And then certain subgroup analyses included PFS and BICR of PFS as well too. There were also secondary endpoints, and tumor was analyzed for HRD via My Choice. So in total, over 800 patients were enrolled. Baseline characteristics were well balanced between the groups. It's sort of interesting that about 30% of patients had stage 4 disease. Most of the patients were actually NED, owing to either a complete cytoreduction or having a CR after frontline therapy. So very interesting. The duration of investigator-assessed PFS was significantly longer in the olaparib and bevacizumab arm than in the bevacizumab alone group. It was a median of 22 months versus 16.6 months. That led to a hazard ratio of 0.59. So essentially a 41% risk reduction in progression or death by having the combination of olaparib and bevacizumab versus bevacizumab alone. So then looking at the various different subgroups, for example, patients who had HRD, BRCA mutated tumors, the median PFS was amazingly 37 months with the combination of olaparib and bevacizumab versus only 17 months in the bevacizumab alone arm. That was a hazard ratio of 0.33. If you're looking at patients that had HRD positivity without a tissue BRCA mutation, the median PFS was 28 months. In the combination versus 16 months in the Avastin alone arm. So that was an a hazard ratio of 0.47. And interestingly enough, in the patients that were negative for HRD or unknown status, really we saw that the median PFS was the same between the two groups, 16 months in both arms, and the hazard ratio there was 0.92. So we did not see any new safety signals. As I mentioned, the trial did meet its primary endpoint. And I think it was very impressive to see the response of the two drugs together, bevacizumab and olaparib, in these patients.